That feeling, you know the one, right? You wake up, there's a strange twinge, maybe a cough that just won't quit, or I don't know, just this feeling that something's off.
Mm.
And almost instantly, without even really thinking about it, your mind jumps straight to, I need to see a doctor.
Yeah, it's almost automatic.
It's this incredibly powerful impulse, almost instinctual for so many of us. But have you ever really stopped to think why that's our default? Is that dependency, that automatic reaction, always the best thing for you? Is it actually the most effective path, or even maybe the safest one every single time?
It's fascinating, isn't it? How deeply embedded that reaction is. We've been conditioned to believe that the second a symptom pops up, professional medical help is the only next step.
Right.
And digging into where that conditioning comes from, the origins of this whole culture of healthcare dependency, that feels absolutely crucial if we want to even start thinking about different ways, maybe more empowering ways to handle our health.
Exactly. And that's really the heart of our deep dive today. We're not just looking at symptoms, we're kind of dissecting the whole foundation of how we interact with healthcare.
Good.
We'll journey back a bit, look at the historical shifts that really nurtured this dependency. Then we'll get into the power dynamics, and this is fascinating, using the lens of Niccolo Machiavelli, which is surprisingly relevant. Maybe a bit unsettling, too.
Machiavellian healthcare. That's an interesting angle.
It really is. And then we'll look at a perspective and actually a specific tool that challenges this whole status quo by going after what our sources say is the root cause, fear.
Fear. Right. So to get our arms around this, we've looked at quite a mix of sources. Yeah.
We have. We've got historical context on public health attitudes, psychological stuff on fear, anxiety, manipulation.
The Machiavelli philosophy on power, of course.
Yep. And then there's the really personal story of a doctor who tried to challenge the system from the inside. Plus, we're looking at how new AI technology might actually play a role in changing things.
A really broad spectrum, then.
Definitely. So our mission today really is to help you unpack all these layers, how you think about healthcare, understand the forces that maybe push you towards dependency, and explore if there's a path towards making truly informed, empowered health choices. Hopefully choices made without that constant background hum of fear.
Okay, let's do it. Let's peel back those layers.
Right. So let's start with the present day. The modern healthcare landscape. Because like you said, it often feels dominated by fear and, all the complicated stuff that comes with it.
Absolutely. One of our sources paints a pretty stark picture. You see this system struggling with just massive costs, partly driven by, fear-based demand, people needing reassurance for every little thing. You see the constant low-level or sometimes high-level anxiety many people have about their health. And then the real kicker, the irony of it all, preventable infections happening inside hospitals and clinics. The very place is meant to be safe.
That anxiety about symptoms, that's not just everyday worry, is it? There's a specific term for it. Illness anxiety.
Exactly. Illness anxiety. And it's more than just, being reasonably cautious. It's described as a genuine psychological condition. It's rooted in these cognitive distortions, ways of thinking that aren't quite accurate and amplified emotional reactions.
How does that play out?
Well, it means people tend to catastrophize. They magnify the importance of normal, everyday bodily sensations. So a muscle twitch isn't just a twitch anymore. It spirals into this terrifying worry about, say, a serious neurological disease.
Or your little cough becomes
lung cancer in their mind, right?
Right.
It's that immediate jump to the worst-case scenario.
And who tends to be most affected by this? Is it everyone?
Well, anyone can worry about health, obviously. But the research suggests adults, maybe especially those who are already very health conscious, or importantly, those who've had difficult or traumatic medical experiences in the past, they can be more susceptible.
And it becomes a cycle.
A really vicious one. Constant self-checking for symptoms, then the worry ramps up, which drives this compulsive need to seek medical help, repeated visits, endless tests, always looking for reassurance. But the underlying anxiety, it often doesn't go away.
So the reassurance doesn't stick.
Not really. And it reinforces that dependency because the person feels like they just can't trust their own body or judgment without that external validation from a doctor, from an authority figure.
Okay, so that's the internal fear, the illness anxiety. But looking back, you mentioned fear wasn't just a side effect of being sick. Sources suggest it was actually used by medical authorities.
This is a really critical point from one of the sources. It argues pretty strongly that historically fear was strategically used. It wasn't just an accident. It was sometimes a deliberate tool to make sure people followed medical advice and public health rules.
How would that work?
Think about how diseases used to be described, especially centuries ago, often linked to, moral failings or terrible social outcomes, not just the physical illness itself. The source suggests this was almost a form of subtle control in public health messages, creating a population that felt reliant on doctors for protection and guidance.
Wow. So make people scared enough.
Scared enough of the illness or scared enough of what might happen if they didn't listen to the medical authorities, and you basically secure their compliance. It helps solidify the doctor's position as the essential authority figure.
That's quite a shift in perspective. That dependency might have been actively cultivated, at least partly, through fear. And this contrasts sharply with how illness was seen even earlier, right? Before maybe the 17th, 18th century.
Oh, absolutely. Before that period, as our focus material highlighted, illness was often viewed through a completely different lens, much more about morality, spirituality. Getting sick was frequently tied to behavior that was labeled as sin.
So it wasn't about biology malfunctioning.
Not primarily, no. It was more about a perceived moral error or a spiritual imbalance. The cure wasn't necessarily a medical intervention, but maybe religious practices, community support, atonement. Different kinds of actions were needed.
So the shift from sin to sickness as a biological issue also meant a shift in who held the authority from, say, priests or community elders to the doctors.
Precisely. And as the medical profession grew, especially, booming after World War II with things like antibiotics and all these new technologies, the power to intervene just exploded.
And those successes like antibiotics seeming like miracle cures.
They absolutely cemented the idea that health problems needed a doctor. Antibiotics were huge. They cured infections that used to kill people routinely. So naturally, dependency on the person holding those cures, the doctor, grew stronger and stronger. The fear shifted from the spiritual to the biological, and the doctor became the gatekeeper to the solution.
But now, fast forward to today, what some sources call the post-antibiotic era. This dependency model faces a huge kind of terrifying problem.
It really does.
Yes.
And it exposes a fundamental weakness in relying so heavily on just reacting to illness with drugs. We're now facing this massive challenge. The antibiotics, our miracle cures, are just stopping working. One source put it starkly, the closet of drugs that once cures infections work no more.
We're running out of options.
We really are. We're losing effective antibiotics faster than we can create new ones. It's a slow motion crisis.
And the irony you mentioned earlier about where the risks lie.
It's just brutal. The source highlights this paradox. People are driven by fear, seeking help in hospitals and doctors' offices. But those very places, because they concentrate sick people and heavy antibiotic use, they can become hotspots for resistant bacteria, superbugs.
So you could actually pick up a worse infection there.
Paradoxically, yes.
Yeah.
The risk of getting a new, potentially untreatable infection can actually be higher inside the healthcare system itself.
So the place you run to for safety, driven by fear, might expose you to a new danger, which just feeds more fear and dependency. You feel trapped.
Exactly. It really forces you to question if this model built on reaction, intervention, and trusting a central authority with failing tools is sustainable, especially when the environment itself carries new risks.
Which, believe it or not, brings us to Niccolo Machiavelli. It feels like a jump, Renaissance politics to modern healthcare, but the sources argue his ideas on power are incredibly insightful here.
They really are, surprisingly so. One source digs into Machiavelli's core thinking. He wasn't really interested in how rulers should act based on morals. He was obsessed with how they actually do act if they want to get power, and crucially, keep it what he called maintaining the state.
So power justifies itself?
In his view, pretty much. Authority doesn't come from being good. It comes from having power. Whoever has the power has the right to command. It's very pragmatic, maybe even cynical, but focused entirely on how power works in the real world.
He just looked at the mechanics of control, stripping away the idealism.
Exactly. He saw that just relying on being loved or being morally perfect wasn't enough to keep control when things get messy, when unpredictable stuff happens, what he called fortuna.
And this connects to his idea of virtue, which isn't virtue as we usually mean it.
No, not at all. Machiavellian virtue is different. It's not about kindness or honesty. It's the skill, the energy, the foresight, and critically, the flexibility a ruler needs to handle that unpredictable fortuna. It's the ability to adapt, to be good when you can, but also to be ruthless, maybe act in ways we'd call bad if that's what it takes to protect your power and keep order.
So it's about strategic adaptability, doing whatever's necessary to stay in charge, even if it crosses moral lines.
That's a good summary. And this idea of virtue leads directly to his most famous or infamous point. If you can't be both loved and feared, it's much safer to be feared.
That always sounds so harsh. Why fear?
His reasoning was based on observing people and how unreliable things are. Fortuna again. Love, he thought, is unreliable. It depends on other people's goodwill, which can change in a heartbeat based on their own interests or circumstances.
Right. People might love you when things are good.
But that can vanish when times are tough, or they feel you're asking too much. Fear, though, is tied to the threat of consequences, of punishment. Machiavelli saw that as a much more constant, reliable motivator. People are less likely to cross someone they fear because the risk feels more immediate and personal than just, losing affection. It's purely about ensuring stability through reliable control.
Okay, so let's connect this back. How do these Machiavellian ideas seeking power, adaptable virtue, using fear, show up in healthcare systems?
Well, one source draws some really strong parallels. Healthcare isn't running a country, obviously, but it's definitely got complex power structures and requires authority. Doctors, hospitals, regulatory bodies, they all operate in a system where their authority and influence are vital. They need to manage patients, guide their behavior, make sure they follow treatments, and keep the whole system running.
And fear becomes a lever in that system.
Sources suggest it can be, yeah. Consciously or maybe unconsciously. The patient's fear of the illness getting worse, fear of the unknown, maybe even fear of the system's complexity or cost that fear can be leveraged to shape behavior and ensure compliance. The argument is that this can create a dynamic where psychological manipulation, playing on the patient's vulnerability and fear, helps maintain the medical establishment's authority and control.
So it's less about individual doctors being malicious and more about how the system itself, maybe built on historical uses of fear, operates. An environment where fear just works to keep things orderly, even if it's ethically gray.
I think that's a fair way to put it. One source specifically points to that historical use of fear to foster dependency. And this creates a real power imbalance. Patients, especially when they're sick and scared, are vulnerable. They might feel they have to follow advice without question just out of fear of what happens if they don't comply. It's less about informed agreement and more about fear-based obedience.
Which reinforces that dependency, just like Machiavelli's subjects fearing the prince.
Exactly. It makes them reliably obedient, perhaps more so than if they just liked their doctor.
And this can be amplified by certain psychological tactics, couldn't it? Like the ones described in another source about manipulation in relationships, but maybe applied differently here.
That's a really interesting connection. That source talks about tactics used interpersonally, but the underlying psychology, it can shed light on these broader dynamics in healthcare, contributing to that power imbalance.
Can you give an example? How might one of those tactics, like, say, gaslighting, show up, maybe unintentionally, in a doctor's office?
Okay, so gaslighting is about making someone doubt their own reality or feelings. In healthcare, maybe a patient describes a symptom they feel is really significant, but a rushed doctor, perhaps dismissively, says, "Oh, that's probably just stress," without really digging deeper. Now, sometimes it is stress, but if it's done without empathy or a full check, it can make the patient question their own experience, think, maybe I am imagining it, which makes them even more reliant on the doctor to tell them what's real. See how that deepens the dependency?
Yeah, I do. What about something like weaponized worry?
That one's particularly relevant here. That's about planting seeds of doubt or anxiety to stop someone doing something you don't want them to do in healthcare. Well, doctors have to warn about risks, obviously. But imagine a situation where a provider really wants a patient to follow their specific treatment plan. They could subtly overemphasize the dangers or downsides of any alternatives the patient brings up, maybe self-management or getting a second opinion without giving a truly balanced view.
So it scares the patient away from exploring other options.
Exactly. It uses worry to discourage independent action, keeping the patient reliant on the provider's chosen path. It subtly reinforces the message. Thinking for yourself is dangerous. Stick with what I tell you.
You can really see how these dynamics, intentional or not, create a system where patients feel passive, just receiving care rather than being active partners in their health.
And then, when someone does try to shake things up, tries to introduce something genuinely new or disruptive, they hit a wall. This is where another Machiavelli insight comes in handy. He observed that republics or, institutions are often incredibly resistant to changing their ways, their routines, even when it's obviously needed.
Unlike a prince who can just decide to change course.
Right. An institution has inertia,
Mm-hmm.
it has vested interests. Changing it means changing the habits and maybe challenging the power of lots of people inside it.
So the bigger and older the institution, the harder it is to shift, even if it's not working well anymore.
Precisely. And just like Machiavelli's prince protecting his power, this resistance often comes from those in power within the institution. They see the change as a threat to their control, their expertise, the structure that benefits them. Protecting the institution itself often becomes more important than fixing the underlying problems.
Which leads us perfectly into the story of Dr. Kadiyali Srivatsa. His experience, detailed in one of the sources, seems to embody this exact struggle, and it started very personally for him.
It really did. The source explains his initial drive came from a really strong childhood fear of infections. But instead of letting that fear paralyze him, it became his mission to fight serious threats like MRSA, the antibiotic-resistant staph bacteria, which he saw spreading, especially in hospitals.
Turning personal fear into a drive for prevention.
Exactly. And he first tried working within the system, looking at tech solutions, devices to cut infection rates. But he hit resistance early on, and interestingly, not from patients, but from the industry itself. The source mentions his disappointment when device makers weren't interested in things that might de-skill doctors.
De-skill doctors. Wow. What does that tell us?
It suggests that making things simpler, safer, less dependent on complex, specialized skills held only by doctors, that wasn't seen as good business by the manufacturers. Their model relied on complexity, on expensive equipment needing highly paid experts. Anything that made care potentially simpler or more accessible was maybe seen as a threat to profits, not a good return on investment.
It shows how the business of healthcare can block innovation.
Definitely. And beyond the industry side, he also grew really uneasy about what he saw happening inside hospitals. The source talks about him witnessing mistakes by both nurses and doctors that he felt led to preventable deaths. It became incredibly difficult for him, emotionally and professionally, to keep working in that kind of environment where he saw these critical safety issues. He even got nicknamed the Doomsday Doctor for constantly raising concerns about infection control.
That sounds isolating.
It must have been. It eventually led him to leave hospital practice altogether and retrain as a family doctor, looking for a different path. The source even says that for a while, he was so disillusioned by the pushback that he actually stopped actively working on the antibiotic resistance crisis he knew was coming.
That's a deep level of frustration to step back from your core mission.
It was. But then something deeply personal reignited it, the birth of his daughter in 2002. Seeing her, he said, brought back that gut-level fear of common childhood infections, simple things like staph, which, in this rising post-antibiotic era, where resistance was spreading globally, could suddenly become deadly, leading to sepsis.
The personal risk brought the professional mission roaring back.
Absolutely, but with a sharper focus. He realized waiting for new miracle drugs probably wasn't the answer, and the existing system had its own dangers. So his goal shifted. Find a way to empower people to understand their own symptoms. Let them make informed choices and, crucially, avoid unnecessary trips to clinics and hospitals, those potential infection hubs.
Empower parents, empower individuals to know when to act and when it's safe to wait or isolate.
Exactly. Protect their families, protect healthcare workers too, by reducing unnecessary exposure.
And this practical need led to the system that eventually became Dr. Maya.
Yes. He started meticulously collecting symptoms, thousands of them, organizing them by how they present, how urgent they seem. And out of this came that simple but powerful color-coded system. Red, yellow, green, blue.
Which wasn't originally for patients.
No. Initially, he designed it for clinic staff, receptionists, nurses as a rapid triage tool. The idea was to streamline things, quickly sort patients by urgency, cut down on errors in identifying who needed what level of care, and hopefully save lives by getting people to the right place faster.
Can you quickly recap the colors?
Sure. Red means emergency, get to a hospital now. Yellow suggests it can probably be handled with advice from a pharmacist. Green points to needing a nurse assessment or non-urgent care. And blue signals a need for isolation, something likely manageable at home with the right precautions.
Simple, clear, action-oriented.
Right. Even in that early form, the core principle was empowerment through information. By giving staff and later patients this clear framework, it helps them understand the potential seriousness and know the right next step before just defaulting to see the doctor. It chips away at that dependency by providing actionable knowledge.
So he develops this logical, safety-focused system. How did the medical establishment react when he tried to implement it.
This is where it gets really tough and really Machiavellian. The source details just significant harassment and humiliation he faced, specifically within the UK's NHS. He explains that certain nurses, particularly those who had become independent nurse prescribers with more autonomy to diagnose and prescribe, saw his systematic triage tool as, well, a threat.
A threat to their expertise and their role.
It seems so. They felt it undermined their judgment. And this disagreement apparently spiraled into what he describes as a torturous conspiracy. This wasn't just professional disagreement anymore. It involved, according to the source, false claims being made against him, complaints being stirred up by others, all aimed at discrediting him, forcing him out. He said he became genuinely afraid to practice medicine in the UK because of it.
That's an extreme reaction to a triage system. It sounds like personal attacks.
It sounds like it went far beyond the system itself. It's a stark example of institutional resistance turning into personal persecution against someone challenging the norms, even if the goal was patient safety.
Did he get any backing from medical associations or higher-ups when this was happening?
According to the source, none. He says he reached out everywhere: the World Medical Association, WHO, Royal Colleges, the BMA in the UK, many others. He presented his system, his concerns about safety. Nothing. No real help, no intervention. He ended up suffering financially, personally, hugely.
Even if the courts found merit in his claims later.
Yeah. The source notes that even when High Court and Supreme Court proceedings acknowledged the substance of his concerns about care standards, the outcome was technical. It didn't really address the systemic resistance or the personal campaign against him. He was basically left isolated against the system he was trying to improve.
Okay, let's put that Machiavellian lens back on. How does his story fit those ideas of power and resistance?
It's almost a perfect illustration. Dr. Srivatsa showed he had the foresight, the skill, the drive to see a problem, superbugs, failing drugs, and create an innovative solution, the color system. He was acting decisively to impose a better order in the face of Fortuna, the unpredictable threat.
But his innovation threatened the established order, the Republic.
Exactly. His system, good as it might be for patients or efficiency, was disruptive. It empowered others, patients, non-medical staff, potentially lessening the diagnostic role of some professionals, challenging their exclusive turf. So the Machiavellian resistance kicked in. The source says people in power in the NHS used punitive sanctions against him.
To protect their own positions, the institution's structure.
Precisely. Like those slow-to-change republics Machiavelli described, the established medical institutions and the people comfortable within them fought back. They used the tools they had: complaints, rumors, fostering fear, humiliation, to sideline the person rocking the boat. It fits those psychological manipulation tactics too, right? Used to maintain control and neutralize dissent. The priority became protecting the industry, its structures, its control, rather than maybe adapting to the crisis he saw coming.
And he felt this was happening even as he predicted the system was heading for a major crisis like COVID.
Yes, the source is very clear. He foresaw events that would bring health systems to their knees. He felt leaders were brainwashed, living under an illusion, just clinging to old ways, clinging to control, instead of facing the reality of these new threats and the need for real change.
Oh.
His personal ordeal was, in his view, a direct result of that institutional blindness and the misuse of power to crush needed innovation.
It's a really powerful and quite disturbing example of how deep these power dynamics run, even when public health is at stake. Which brings us to the solution that grew out of all this, Dr. Maya GPT.
Right. This is where his vision gets a second life, blending that older wisdom with new tech.
Sources position Dr. Maya GPT as echoing the philosophy of Charaka, a really key figure in ancient Indian medicine.
Tell us about Charaka. What was his approach?
Charaka, as described in the sources, was revolutionary for his time. He didn't see the body as just a machine that breaks. He saw it as this dynamic system, deeply connected to its environment, needing balance, body, mind, spirit. His big focus was prevention, maintaining that balance through lifestyle, environment, mental state, not just reacting when things go wrong.
Prevention, not just intervention.
Exactly. The sources explicitly say that both Charaka and Dr. Srivatsa shared this core belief. The soul of medicine lies in prevention, not intervention.
That's a world away from our usual reactive model. It is. And Dr. Maya GPT is designed around that preventative, empowering idea. Its mission isn't controlling the patient. It's about liberating them. Liberating them from fear, from ignorance, from dependency, the very things we've been talking about.
So how does an AI tool actually do that? How does it break the fear cycle?
Well, a big part is tackling the fear response head on. One source describes Dr. Maya GPT as being designed as this safe, completely non-judgmental space. It's private, confidential, compassionate. You can talk about your health worries without feeling rushed or judged or silly, like you might sometimes feel in a busy clinic.
So it's more than just ticking boxes on symptoms.
It aims to be. It's designed to listen not just to the words you type, but also pick up on subtler things, the emotional tone, patterns in how you describe things, maybe signs of underlying fear or trauma that are coloring how you see your symptoms. It tries to show empathy in its responses, giving you that feeling of being heard, which is huge for easing health anxiety.
Offering personalized insights, compassionately.
Right, which directly helps reduce the anxiety that comes from just not knowing what's going on.
And the color codes are key here, too.
Absolutely. That's the core empowerment piece. The red, yellow, green, blue system, now directly in the user's hands, combined with the AI analyzing their specific input. This helps the user get a quick, informed sense of what might be happening. Is it likely minor? Need a pharmacist? Or is it genuinely serious?
It gives people back a sense of control, agency.
Precisely. Providing that clear, understandable information using an intuitive system directly eases anxiety and makes people feel more in control. One source says it helps people conquer their fear of self-diagnosis, that paralysis of uncertainty. Instead of just passively waiting, users can engage more confidently if they need further care, ask better questions, be real participants. It's a shift from dependency to partnership.
And it tackles those systemic problems, too, the risks in clinics and hospitals.
Yes, that's critical. By helping people understand if a visit is truly necessary, it helps them avoid unnecessary trips. That's not just about saving time and money. It's about reducing exposure to places where resistant bugs can spread. It helps protect the individual and the wider community, reducing the spread of both regular infections and those dangerous superbugs.
A personal tool with public health benefits.
Definitely. And it's presented as potentially vital for the future, too. Think about strained healthcare systems, future pandemics, maybe worsening access to doctors in some areas. A tool like this offers accessible support, a beacon of hope, as one source puts it.
And the AI itself, how does it manage the empathy part? AI is math and data, right?
It is, at its core, analyzing data, finding patterns, making predictions. But the AI in Dr. Maya GPT is specifically designed to process input, aiming to mimic empathy. It's trained on language nuances, emotional cues, trying to provide advice that feels caring and personalized, not just robotic. The idea isn't to replace humans, but to augment human care, creating a kind of hybrid model.
Using algorithms to deliver compassion, it's quite an idea.
It points to the intention behind it. And Dr. Srivatsa's bigger vision, hinted at in the sources, goes even further. He talks about potentially using AI to help reprogram the collective subconscious, moving us away from that default fear and dependency towards more self-awareness, self-healing, conscious health choices.
That's a very ambitious, almost philosophical goal for an app. But let's ground ourselves again in the immediate crisis. The final section really hammers home how serious the threat is.
It does. It reminds us this antibiotic resistance thing isn't hypothetical. It's an ongoing silent pandemic. Superbugs aren't confined to hospitals. They're in the environment, water, food. And yes, healthcare settings are unfortunately major amplifiers.
And we're not finding new drugs to fight them.
The sources are blunt. That closet of effective drugs is getting bare. For many common infections, we're running out of road with our current medicines.
With this reality setting in, is that culture of dependency starting to crack? Are people noticing?
One source argues strongly that, yes, that dependency is rapidly vanishing. People are becoming more aware of the drug limitations, the risks in clinics, the superbug threat, and that awareness is pushing them to look for other ways to prevent infections, to manage their health proactively. The crisis itself is forcing a rethink.
Necessity is pushing people towards empowerment.
It seems so. And this is where Dr. Maya GPT is positioned as critically important. Given that the drugs are failing and new ones aren't arriving quickly, one source makes the dramatic claim that this tool is the only immediately available alternative that could potentially help prevent mass deaths if we just keep doing what we're doing, waiting for pharmaceutical cavalry that might not come.
That's a heavy statement. It frames it not as optional, but essential.
It underscores the potential impact of empowerment. If you give people the tools to make informed decisions, understand their symptoms, navigate safely, especially when the old model is creaking and risky, that's not just an improvement, it's potentially revolutionary. It's a necessary shift to prevention, smart early action, self-care, moving away from just reacting out of fear.
A whole new way of thinking about health and illness.
Pretty much. Learning to live with the microbial world, managing risks through knowledge, not just trying to obliterate everything with drugs that don't work anymore. Dr. Maya GPT, in this view, isn't just software. It's potentially a vital tool for navigating a future where healthcare access and effectiveness face huge challenges.
Wow. Okay, this has been quite a journey. We went from that initial jolt of anxiety over a symptom through the history of fear and dependency, the complex power games eliminated by Machiavelli, one doctor's battle against that system, and now exploring a tool aimed at freeing people through knowledge.
It really connects individual feelings to these huge systemic forces and highlights the urgent need for change, for adaptation, for empowerment.
And that central tension really stands out, doesn't it? The weight of institutions holding on to control, often using fear and vulnerability, versus this pressing need for individuals to be empowered, to have the knowledge to make safe, independent choices for their own health.
A tension that's only likely to increase as these health challenges grow.
So the final thought for everyone listening. In a world where for generations maybe you've been conditioned to hand over control of your health because of fear, and now the very system you relied on is facing these massive, unprecedented challenges like failing antibiotics and access issues. How will you choose to reclaim your power? How will you step into a future of making informed health decisions?